This is part 2 of the lecture on documentation. We're going to talk about personal health records. So we have two types of our personal health records. The standalone, the patient develops on their own. They may have some kind of software system or some app they might use where they can keep track of all their lab tests, medications, surgeries, etc. So that's something that they create. And then your tethered is a provider link to the patient's health record. So the patient goes through a secure portal and they can view all of their information, their visit history, immunizations, labs. They can send messages to their provider. Then we also have home healthcare documentation, which is determined by Medicare requirements for adult patients. They have the Outcome and Assessment Information Set, or OASIS, OASIS. So OASIS represent core items of a comprehensive assessment for all adult home care patients. With the OASIS, it forms the basis for measuring patient outcomes for purposes of outcome-based quality improvement. So they go by the patient's progress with the OASIS. So on admission, they score the patient at a certain number on the OASIS. And then at discharge, they have to score them on the OASIS as well. So hopefully there's an improvement from admission to discharge. There's also a recertification OASIS if they're kept longer than, I think it's 60 days. Don't quote me on that, but they have to do a recertification at a specific time period to state, why they still need to have home health care, what their condition is like at that point in time. So it's pretty much to, monitor to see if the home health care agencies are making improvements in patients that they care for. Then we have our long-term care documentation. We have our minimum data sets, which is part of our resident assessment tool, also known as the MDS, which anyone working in long-term care, I'm sure you've heard of that terminology. This information is all important because of Medicare and Medicaid reimbursement. So with the MDS, there are several elements to it. So like there's nursing care, the demographics, the service, which would be like admission, discharge dates, expected payer for services. And all data is distributed among caregivers in a standardized format. With the MDS, it allows for evaluation of patient problems and then their progress. Triggers occur when the MDS has identified one or more risks or a current problem that warrants more evaluation using the resident assessment protocol. And then the resident assessment protocol, that is a framework for organizing minimum data set information and looking at clinically relevant information on a resident. And then utilization guidelines. These guidelines are specified in state operation manuals that direct when and how to use the resident assessment tool. So one of the purposes of creating a patient record is to evaluate the quality of care patients have received and the competence of the nurses providing that care. That would be true. A nurse who fails to log off a computer after documenting patient care has breached patient confidentiality. That would be true. A patient has the right to obtain, review, and revise the patient information in his or her health record. Well, that would be false. They can obtain a review, but they cannot revise.